Welcome to the serum extraction experiment. During this exploration, you will learn how to extract serum from a blood sample. By the end of this experiment, you will gain valuable insights and achieve the following learning objectives. 1. Understand safety precautions for handling blood. 2. Recognize different blood collection tubes. 3. Perform centrifugation. 4. Understand the methods and techniques used to separate serum from blood samples. Remember, always refer to the lab manual and understand the theoretical concepts of the experiment before beginning. Get ready to explore the exciting process of serum extraction through our engaging and interactive experiment. Let's begin. You can track your progress using the progress bar at the top of the page. Personal protective equipment. For the serum extraction experiment, it is essential to wear the following personal protective equipment to ensure your safety and prevent contamination. 1. Lab coat. 2. Gloves. 3. Safety goggles. 4. Closed-toe shoes. Choosing the right collection tube. Let's start by identifying the appropriate blood collection tube. Which tube should we use for the serum extraction experiment? Red cap tube. The red cap tube typically does not contain additives, allowing the blood to clot so that the serum can be separated. Step 1. Labeling the sample. Before starting your experiment, ensure the blood sample is properly labeled with patient's name, patient's birth date, patient ID, date and time of collection. Click on the sample to check the labels. Avoid vigorous shaking of the blood tube to prevent hemolysis. Step 2. Allowing the blood to clot. Place the blood sample on the rack and leave it undisturbed for 15 to 30 minutes to allow complete clotting. Step 3. Checking for clotting. Click on the blood sample and tilt it gently to check if the blood has clotted. What do you observe? The sample is not fully clotted. Leave it for a few more minutes to ensure complete clotting. Step 4. Leave the sample for a few more minutes. Step 5. Confirming clot formation. Tilt the tube gently again. The blood is fully clotted if the clot remains stationary when the tube is inverted. Well done. The blood is now clotted and ready for centrifugation. Before you proceed, consider the following precautions. Avoiding exceeding the recommended speed or duration, as this can damage the samples and affect the results. Avoiding vigorous shaking or excessive movement of the blood samples before and after centrifugation to prevent hemolysis and contamination. And balancing the centrifuge by placing tubes of equal weight opposite each other. Step 6. Put the tube in the centrifuge. For balancing the centrifuge, another tube filled with water of the same volume is added to the opposite side inside the centrifuge. Press open, and for 10 minutes, centrifuge the clotted sample at room temperature, 25 degrees Celsius, for 3,000 revolutions per minute. Press start to begin centrifugation. And stop to turn off the centrifuge. Step 7. Removing the tube. Click on the centrifuge to open it. Carefully remove the tube and place it back in the rack. Ensure the cell components remain undisturbed. Step 8. Serum separation. Using a Pasteur pipette, gently aspirate the serum into a clean, labeled test tube. Insert the pipette tip into the serum layer without disturbing the clot at the bottom. Take care while transferring the serum if it is very close to the clot. Tilt the tube slightly to help keep the pipette tip in the clear serum layer. Click on the sample to begin serum removal. Step 9. Inspecting the serum. Now it is time to examine your sample. Only one serum sample from these test tubes is considered normal. Click on each tube and try to observe the difference. Do you think this sample is normal? Yes, a normal serum sample is pale yellow and clear. Your sample looks good. Let's compare it with your colleagues' results. Step 10. Comparing serum samples. Now, zoom into each tube in the rack to examine it thoroughly and observe the difference. What do you observe? First, sample hemolyzed serum, likely due to intravascular hemolysis or improper handling. Second sample, hemolyzed serum, same possible causes. Third sample, lipemic serum, due to elevated blood lipid levels. Step 11. Storing the serum. Unless you plan to use your extracted serum right away, promptly store it in a refrigerator at 2 to 8 degrees Celsius to prevent degradation. Click on the refrigerator to place the sample inside. Make sure to use the serum sample in the next 24 hours. For long-term storage, store it in a freezer at -20 degrees Celsius. Congratulations! You've successfully completed the serum extraction experiment. Your careful technique is essential for accurate results. Keep up the great work and continue refining your skills.